What we need to realize is this healthcare problem doesn't just affect random people. These are our classmates, young professionals, friends, siblings, who've all been affected by this healthcare crisis.
For example, like I'm with Mass Health, and they're trying to cut my insurance because they're saying that I can afford the college insurance, so that I don't have to get healthcare with them. They would rather that me pay for the health insurance, but they're cheaper than the school's health insurance. I can't afford the school's health insurance, so it's not fair that they're only going to give me partial coverage. So I can't even go in to get I can't go to get checkups. I can't go to get certain things because they're going to charge me. They're going to charge me like what I shouldn't even get charged because they feel like I should get the school's insurance.
I know somebody that's very close to me that needed medication to basically stay alive. Now his income changed a couple times, and they sent him no notice, and they cut his insurance off completely. Basically, he got a pay raise. Okay, when he got that pay raise, they decided that he was at a different income level and that he should pay each month. Okay. And then when that happened, they just cut it completely.
I was diagnosed with a deep vein thrombosis, a DVT. I'm not sure if I'm pronouncing it correctly. But basically, I had to give myself injections as a blood thinner to thin out the blood clot. I believe the medications would have cost me $500 to $1,000 per box of medication, which means that it would have been a lot of money per injection. Because of my wonderful health insurance, I paid $10 a box. I have no idea how I would have done it without the health insurance.
And it's the same thing goes with my mom. My mom has a sickness. She can't afford to get the good health insurance to cover the medicine for her disease. So she has to stay with the insurance she has now, but it won't cover it. And I feel like that's not fair that just because she can't afford the medication that she can't get it, because you know what I'm saying? Like it's a life-threatening disease, and it's not fair that it goes by what you make.
I can only imagine what would have been if it was cancer or AIDS. So the people in poverty wouldn't have had that medication. There's no way. I just opened my eyes. It was such an eye-opener to know how much medication actually cost and how privileged I was to actually have health insurance.
If there's a senior citizen somewhere who can't pay for their prescription drugs and having to choose between medicine and the rent, that makes my life poorer even if it's not my grandparent.
Dottie Slack understands this firsthand as she works with the elderly and sees and hears devastating stories.
Sometimes what their costs and prescriptions are is greater than what they have coming in to their home. I have had elders come to the Brockton Council on Aging where husband and wives are sharing oxygen, they're sharing medications. In one particular incident, I was able to the wife was eligible for Mass Health under a special program that's available for elders that meet the criteria for nursing facility placement.
I had a son that was touched by cancer. Extraordinary health bills that we were able to afford, and we received the very best. It would have obliterated and wiped out the savings of any family.
And then there's Sue Josh, Chief Executive Director of the Brockton Neighborhood Health Center, and 2009 Athena Award winner for her service to the community. She feels there's a loophole in the system when patients need specialist care.
So if our patients come to us for care, we're doing the preventive, the primary care, we're able to get them very low-cost medications, all of that is great. If they're sick enough to need to be in the hospital, we have a great system of hospitals in Massachusetts who will take patients regardless of insurance, and that piece works. But there's this huge gap in the middle on the specialist side of what do you do when you need a specialist, when you maybe need a minor surgical procedure, maybe you need to see a dermatologist for potential skin cancer, for example.
Just like all of us are on the tip of the iceberg, way up high in the healthcare services. We've got the very best, all of us at the tip of the iceberg.
Well, we have people that are living on the street. We have a young man that was living on the street, living in a dumpster, you know what I'm saying? Didn't have any health care. We brought him into the shelter. We hooked him up with some health care. His health is better now, there was a little bit of substance abuse there. Today, this young man is going to be moving in housing. We've had individuals here, and as I think about this, when you're asking this question, for the 15 years I've been here, we've had individuals come in here with cancer, and they're homeless, and they can't afford to get the treatment. you know, and the resources, you know, and here we have case managers here searching out for resources to help these individuals, you know. Now we have the Cancer Society, you know, but, you know, imagine, wouldn't it have been nice if the person had health care and didn't have to go through that, and he could work on his homelessness and work on his health?
Because we were able to afford it. It would have bankrupted any average family in this nation. Any average family that is represented in this hall this afternoon, and the millions of people that you represent all over this nation of ours.
Fewer and fewer physicians are going into primary care. There's a huge shortage in that area. And, you know, they can make a lot more money and have a lot more easy lifestyle if they go into one of the specialties. So that, I think that whole reimbursement model needs to shift, needs to rebalance so that the specialists are still paid adequately, but so are the primary care physicians.
But I want every delegate at this convention to understand that as long as I'm a vote, and as long as I have a voice in the United States Senate, it's going to be for that democratic platform plank that provides decent quality of health care, north and south, east and west, for all Americans as a matter of right and not a privilege.
One thing really that we need to focus on as a society around healthcare is what else is it that helps keep people healthy. So in the health center world, we have wraparound services such as interpreters and nutrition, and you know, it's starting to move beyond that in some communities, and in Brockton you're starting to see that wellness activities, educating people how to stay healthy, dealing with the obesity crisis. You know, my opinion, you should be banning unhealthy foods from the schools, and a lot of schools have started to do that, at least on the drink, you know, banning sugar sodas and that kind of thing from the vending machines. But just healthcare is not enough to keep us healthy. There's got to be, you know, healthcare reform along with a whole reform of lifestyles.
Everybody has a right as a human being to be treated with respect and with dignity and receive the same quality of care and the same quality of life as anyone else.
New hope that we will break the old gridlock and guarantee that every American, north, south, east, west, young, old, will have decent, quality health care as a fundamental right and not a privilege.